Wholeness. So we've talked a bit about caregiving, we've talked a bit about imagery, but what about wholeness? What is wholeness? How do we think about wholeness, right? And first, let's think about it through the lens of this practice that we did, this kind of modified Kirtan Kriya exercise, which enables the participant to experience relaxation and a kind of connection, perhaps, with something larger. So that's a kind of aspect of wholeness. It's internal, so from the person's own perspective or experiencing of consciousness. And in that way, you could say similar to many of the mindfulness exercises that are taught within clinical practice of, for example, focusing on the breathing or focusing on a sound in the room and not judging it, simply being present to the experience of it. But is that wholeness? Is that all of wholeness? Right? Well, wholeness would be everything that is. And wholeness would therefore include yourself, your own mind, but also other people and other people's minds, and your social environment, and the larger environment and web of connectedness in which you live. And so the therapy that I've been working to develop, in which I'm going to show you some of our pilot results from, is about how do we use guided imagery to engage with that level of wholeness. Okay? And the name of the therapy is mentalizing imagery therapy. What mentalizing refers to is how we understand another person's as well as our own mental life, our thoughts, our feelings, emotions, motivations, needs, desires, and those of our loved ones. How these internal phenomena, our own thoughts or our own emotions, translate into our external behaviors, and how we impact on our loved ones, how that affects them on the inside and changes their reactions to us on the outside. So wholeness within mentalizing imagery therapy is about grappling with that, right? These very, at times, wonderful, at times troubling, at times difficult, challenging, stressful situations that we find ourselves in. Right? Another definition of mentalizing is holding another's heart and mind in your own heart and mind. It's not just a thinking kind of process, a cognitive process, it's also emotional, right? And it pertains as well to you. So in some of our exercises, you learn to hold your own heart and mind in your own heart and mind. It sounds a little bit abstract, but these caregivers learn how to do it. And it differs in this way from positive thinking. Positive thinking, in a way, is like trying to grasp on to those positive thoughts amid a maelstrom of the negative. Right? This is different. Wholeness is different. Wholeness is about observing, holding in mind both positive and negative. You could say the yin and the yang of it, the active and the passive, the good and the bad. And being able to see them all within our awareness without being as troubled by them, without being as reactive to them, and then using that perception of wholeness to help us guide our actions internally, our actions in relation to our loved ones. So let me give you an example from a caregiver who actually did our program. And she was 68 years old. She and her spouse had been married for more than 30 years, but he had developed dementia over the prior 6 years, and more impairment over the course of time, to the point that she had to help him get dressed every morning. And as she recounted it, just the thought of having to do this the night before would make her tense. Her neck muscles would tighten, she would think about it, and she felt like it was something that she had to do for him because he was sick. Right? And also, and she couldn't really understand this for herself, she felt like he wasn't trying very hard. Now, he was a very intelligent person. He'd been an engineer. But at this point, he couldn't button his own shirt. And she just had this sense that she was putting in all the work, all the effort, and there was no reciprocation on his part, and she didn't know how to think about those thoughts that she was having about him. And so she did one of our exercises that involves putting oneself in the shoes of the loved one who's caregiving or who's receiving the care. And going through this challenging situation from their perspective, using a kind of guided imagery approach, going through it from her own perspective, and then remembering the ways in which she was interconnected with him over the course of time and how the challenge fit in. And she said after she did this, she was really excited to get up the next morning and to try to put her own realizations into action. And what those were was that she could appreciate that from his perspective, he was trying. He was trying the best that he could, but she couldn't see it from the outside because he wasn't making any facial expressions that would tell her that he was trying. He wasn't moving his hands in any way that would tell her he was trying. And she was stuck on the outside of that. She was unable to peer in. So she said she could actually experience a sense that from his perspective he was trying. And also that this challenge of dressing him could be seen not as something that she was doing to him because he was sick, but could be something that was one of the thousands of challenges that they had encountered over the course of their 30-plus year marriage, because marriage was never always easy. There were always challenges that came up, situations that had to be solved. And so she could see herself more walking alongside her husband as a challenge both of them were confronting together. And the next morning, she said she went about dressing him the same way. She laid the clothes out in the same way. She helped him put his arm into the sleeve and button up. But there was something different about it. She felt a different sense of lightness as she was going through it. She felt less anxious. She felt tense. And afterwards, her husband, who was suffering with a moderate level dementia at that point, actually turned to her and said to her, "You're so kind. You're so caring." It was as though something had translated non-verbally into the situation such that he could appreciate it, and he embraced her. It was a kind of moment that the two of them hadn't had in a very long time. That's using guided imagery to promote wholeness, to promote a sense within a situation of what's going on the inside, how that translates to the outside, of deepening those connections so that things can be less stressful, more easeful, more caring. With a psychologist at University College London, who's considered to be the world's leading expert on the theory of mentalizing, or how we understand ourselves and others, I recently published on the theory of how this works, along with a case series of participants like this woman who had gone through this program. And the components of it include several things. So there are centering exercises within the body, you could say gentle chair-based yoga. There's promotion of mindful awareness. Mindfulness being, as John Kabat-Zinn defined it, paying attention in a non-judgmental way, curiously in the present moment, to experience. And then it moves a step further to engage imagination. One's imagination of how one experiences these relationship situations, how other people experience them. Imagination pertaining more broadly to the communities in which you're a part, and other people's perspectives with them, your own perspective. Imagination that extends to how you're connected with nature, with your larger natural environment. And what are the quantitative results that we've seen? So just in the past 2 months, we've been analyzing some of the data from our first randomized controlled trial with 53 caregivers.